Good afternoon, friends. We are live now, and we shall be discussing on today the introductions in case taking for computer. Friends, it is very important that you must have better introductions. Because the introduction is the part that it makes an impression upon the patient, and this is very important for you to impress your patient so that you can influence them with your and generate the faith within them. So today we are going to discuss this matter through our PowerPoint presentations, and I hope you will like it. So I am just sharing my screen. So it is an introduction during the case taking. The first thing that patient encounters with us, we have to get introduced with each other. Patient will be introducing himself, and you will be introducing yourself. So it is the both way. It is not a one-way traffic, but both people, both persons, the person and attendant seated before you, and you interact together to get the influence and understanding about the problems and taking into consideration strategic factors. Now, uh, by introducing by introducing to you yourself, it enables to discover for yourself the true meaning of life, and thus enrich every moment of it. Such self-discovery can lead to great understanding of fellow beings and therefore to true lovers. This is very good quotations that is very much required for us. Before introducing ourselves to the other, we must know how we must introduce ourselves to him. So self-introduction is very important because it gives you the true meaning of the life, where you are and what you know, what is your understanding, what is your belief. This is, and with these beliefs, with these understanding, and with these things, you meet the people and you interact and you talk and behave in the society or before any other persons. So it is also said that the doctor who don't know himself, he cannot make a good impressions or good understanding of the patients. Friends, there is nothing more difficult. There is nothing There is nothing more difficult to take in hand, more perilous to conduct, or more uncertain in its success than to take the lead in the introduction of a new order of the things. So it is one of the it is called ice breaking point. Ice breaking, it is the beginning, and when the beginning is okay, the things goes well. So how this is very sensitive moment. The introduction part is very sensitive to you, and it will help you to understand and make your entire discovery of the patient in a very easy flow. So introductions, you have to be very much careful how you are introducing to the patients and how the patient is introduced to himself. Uh, Dr. Henneman, in Organ of Medicine, under a file 104, he writes, once the totality of the symptoms that principally determines and distinguishes the disease case, in other words, the image of any kind of disease, has been exactly recorded, the most difficult work is done during the treatment, especially of a chronic disease, and art medical art practitioners then has the total disease image always before him. He can behold it in all the parts and lift out the characteristic signs. So uh, this is the perception. It is about the perception, your sensation, your everything get uh, um, combined together during the case taking. It is the It is a test. You can say that it is like a facing an examinations. Seated before a patient is like a facing before with all your knowledge about the organ and medical laboratory, your medical science, everything, and with these backgrounds, you are seated before the patient. So these moments are very important because with these moments only, with these understandings only, you are going to know and find out the. So it is an art, it is a science, and it is a and it is a skill. So skill development is very much important, and you know that the practice makes the skills. When you have a good practice, you have to keep on, and practice depends on your perseverance. How much you continue and not get frustrated. Many a time the patient will not be there in the clinic and you get disappointed. Many a time there are the situations that you have the no earning and then you get disappointed. And the moment you get disappointed, you are not going to succeed in the life. Success and failures are the part of your perseverance. If you have the perseverance, everything you can do in your life. So, good practitioners, and this is the theme Dr. Henneman wanted to tell you in FI number 104. Friend, now the patient is before you. You are entering the mission field. The patient that you have passed your medical court examinations, and now you are treated before the patient, and patient is your mission, and it is your target. It is your area where you have to apply. It is called the case taking is the applied part of your understanding that you have read or understood during your case taking, during your learning periods at the graduation level, post graduation level, whatever level you have, you are there. Your qualifications is at the test when you are seated before the patient. Friends, observations. Observations. What is the meaning of observation? First part, first thing is the observations. You have to what you have to see. The first thing that you have to see how the patient is entering, coming inside the clinic. He entered with the support. He's confidently, freely walking, limping, staggering, or hesitating very, very slowly. Then his facial reactions, whether he is fearful, anxious, indifferent, smiling, joyous, happy, desperate. How wishing. Then he comes to you and make wishes smilingly or indifferently or not wishing, he is silent or he is in the with you. So in different way the patient is coming to you and starts and introducing himself. Then he is waiting to be told to be seated or he takes the seats immediately or keep standing. He has to sit. But whether he takes the seat himself, whether he has been asked to sit, or in spite of asking to sit, he keeps standing. So now this is the hesitations, this is the area you can understand many of the rubrics that you can observe as moment the patient is entering into your clinic and uh, waiting for the doctor to initiate the case taking or start speaking or narrating the problems. The, usually it happens that patient comes and sits before and doctor asks, sir, what is the problem with you? So this is the initiation from the doctor. But impatient patients are there. There are patients who are very hurried nature, very impatient nature. They start speaking as soon as they enter you. And don't wait for the doctor to initiate. And you have to observe the body language. Now the body language is very important because talking and your verbal language and body language both combines to give you the natural language. The verbal language and the body language, they combines together to be how I talk, whether it is the right way, it is truth or wrong, it is expressed. Suppose I want to hide something, it gets expressed with your body language. If he is telling lie, if he is hiding something, it is expressed through the body language. So whether he is speaking very honestly or dishonestly, this is very important. You have to. So you have to be very observant in nature. Observation is a beautiful part of the life. God has given you eye and 2 ears and only one mouth. Why? Why one mouth and 2 eye and 2 ears? Only because you have to see in the wider level, you have to listen in the wider level, but you have to speak less. Speaking less, looking at your should be vision should be more and listening should be more. This is the very important things that I have learned during my clinical practice. I have understood and read these things, and I find that the more less I speak, more I get. So it is called the observations part. Less you speak. You don't have to talk too much. Let the patient speak. Let the patient talk. Whatever way he's angered, he's getting fearful, whatever anxious, whatever this way. But that observation makes you a great difference in your medical practice. Initiating the case study. Now, be pleased to see the people. Now it is your part. You have to show them that you are happy to see them. Smile and talk with enthusiasm. Shyness can often hide the fact you are actually pleased to see the people. So it is important to understand how you come across to the other. And it is not so much about what you say, but how you say it. What you say is not important, but how you have to talk. Is it very? You are not talking with enthusiasm. It is just a with the indifferent type of the talks are there, but you have to show the enthusiasm, interest. This is important. Then offer the genuine compliment. Tell people if you like their work or handbag or their last email made you laugh. The golden rule here is to make sure the compliment is genuine. Now, what is the purpose? The purpose is to make the patient free, confident in you, so that he can speak freely. And don't make something up. It will come across as being fake or the odd. Now, remember all the small details about the poor workers, what the other workers are doing, your staff, friends, hobby, weekend plans, home projects. There are many things in your life, your family, your money matters, your wife, your children's. There are many things. Whether they are part of your clinic, no, they are not the part of your clinic. They are dependent on you. They are your co-worker, but you have to keep them aside when you are seated in the clinic. This is your mission. This is your temple. It has to be. The case taking is like worshipping a god. A god is seated before you. If you learn seeing the god within a patient, you can learn the beautiful things, and you can get the wonderful symptoms from the patient. Using your surrounding to trigger the conversation is recommended by this site. Point out the piece of artwork or the photos or decor. Ask them what they think. Now, what I usually do when a patient comes to me, if he is wearing a black pant or white shirt, I ask, why you are wearing the white shirt? It is just going to initiate the curiosity. If he has got wearing the glass, if his glass is not fitting, so whether from where he purchased the glass. So silly questions are important. These things make the patient feel comfortable in the clinic, because it is the place where the patient are not accustomed to come. It is not their workplace, it is not their home, it is not their place of dwelling. It is the place where he have come for some business or some purpose. Now, the fifth point is the match the listener's mood. What he is listening, and this is important. And you have to his mood, where his mood is. Mood are very variable and very changeable and very problematic substance. This is the site explain why it is important to match the listener mood. If you are shy or you are unlikely to bound over the excited person with a big handshake, ask how they are enjoying the party. But the basic idea works if you see a person who looks bored, tired, shy, match their mood when you start the conversation. The patient is coming to you in the pain. He has got lot of the pain. He's absorbed himself, but you have to see the mood. If you are asking some different questions while he is in the pain, something different from his pain, he will you will not get the proper answer. Ask a question. People love to talk about themselves, so that this is the perfect way to start conversation. Now, asking questions, what type of the question, what the person's like. It is like pleasing them, or it is like making them feel better. If you know them, you can ask about their family or work. If you are meeting them for the first time, you can ask uh, the usual way where you are from, what do you do, what you want. These are the questions. For shy people, asking question places of conversation focus on the other person's, giving you time to feel and relax. If the person is not too much talkative, is very silent in nature, then what you have to do? You can divert the attentions by and making the patient relax so that his shyness gets ended. Now the seventh point is non-verbal communication. Smiling is the best medicine. So confident, outgoing people have open body language. They make eye contact and smile. Have you ever seen a patient and see the patient looking at his eye, looking at, or you see it somewhere else and asking to your eye is on the computer and you are asking to the patient? No, you are not going to make a eye contact. You are not going to get a better results. So it is to get a better result, you have to talk confidently so that you can get the better reply. You have, if you have trouble looking people in the eye, start looking at them between the both eyes. If you can't concentrate on looking on the both eyes, just try to look at the middle of the between the eye. They will not be able to tell you, and it gives you a chance to feel comfortable and increase your eye contact. If you often look down or away, make a conscious effort to look at people when they are talking. Once this becomes habit, you will do it automatically. Now, with all these things, we start writing or taking notes from the place. Now, there are the different ways you can make a note. It is part of the record keeping. We can take up this case in a different session. But you have to make use of the date. The first thing that you have to note down is the date, because it is the divider line of the case which was in the past and future length of the day. Now, from this date onward, the patient is with you, and from this date before, the patient was not there. It is important to put the date when you start noting the date, and it also helps you to keep the future evaluation. After patients coming after 1 month, 2 months, how you can evaluate? Within 1 month, what is the progress? Within 2 months, what is the progress? So this noting down the date is the most important part of your case taking. Now, then you have to ask the name. How many names you have? There are different names. Some people have nicknames. Some people have family names, change of name, or any suffix. Like I the family name is name given by the family members, and nickname it is a call by lovingly people say Munna, Babu, Pappu, like these words they come out. So these are called the nickname, and his family name is different. It is selected by the traditional way or by some influence from the other. Then often one make changes in their name, and often people make like any suffix. They when they grow up, they put new suffix like um, Ram Kumar Mastana. Mastana is the suffix that he is using. Mastana is now why he has put Mastana. This is important because it gives you the nature why it is what type of the person he is. So this helps you in understanding the person. Try to find out the relevance of name in aspect of the patient's life. Knowing the meaning of the name also provides a strengthening faith of the patients regarding doctor and treatment. What I see when patient comes to me, I ask, "What is your name?" They say, "Doctor, my name is such and such." Oh, what does it mean by the such and such person? Immediately he may be knowing the meaning, he may not be knowing the meaning. So whether he is a very serious type of the person, if he is knowing the meaning, he is serious. If he is not knowing, he is not serious. He is a careless type of the person. Be cool when you are asking the name from elders one. Now asking the name from the seniors, the people who are senior citizen of the society, and you have to show affections to the children. So different category of the patients require different type of the asking and the situations for the cases there. Now, what is the importance of the name? Name is often indicated as the expectations of the parent or the guardian. Name is not given by you, but some after changing you can changing your name, you the expectations changing it is your choice. But first name that you had, it was given by your parents, and why the parent has selected this name is important. It is their expectations, it is their will, it is their understanding, and you may find the personality matching the name, and often they are sometimes like the Ram, and he is behaving like a Ravan. Now, this is the contrast. He is not coming to the expectations of the parent. This gives some idea about the personality aspect. He may be obedient, complying to the parents' wishes. He might have become rebellion or may not be able to accept the contradictions. So, contrast in the name or from the family members, it can give you some hints toward the personality of the person. All these things are very minor, but it is very important because minor things, when they accumulate, they mix the bigger meaning. Some nicknames are also much indicative of nature, affectionate, rude, or other types. Or name also provides the sympathetic change in the present life. Some use suffix against their name and frequent change of the name. Some used to keep changing, making going to the court and making affidavit and very simple to it. Why it is like that? He is a changeable person. He is some person who is trying to hide himself. So many questions arises when you see the name. You can see the Aadhaar card of the person. The name is something else, and he is being called in a different with a different thing. The persons will come like to you like this also. Now, next part is the age. You must try to get the exact date of birth. In some people, you may find difficult in assessing the age, as some people are in habit of hiding their age. Like if you ask the age of a girl, he will always tell you the lesser age. And if you asking an adult boy, he will always try to behave like a bigger boy. So, and hiding this is so getting exact date of birth is important because you have to deal with that. And when he is hiding his age, this is also gives you the his complex, inferiority complex. This also you may find useful information regarding personality and the patient's mind. Now, what is the importance of the age? Some diseases are related to the age, like diabetes usually happens in the advanced age, influenza in the children, and if they are opposite to becomes more relevant in thinking about the miasmatic involvement. If you find a diabetes in a children, the miasmatic involvements are there. And if you find the influenza in the elderly patients, there is also the miasmatic. The opposite things are very important. Some people look older than their age and some are younger than their age. And aging process have definitive relationship with the disease development as well as the mental state. Some people behave more than their age, precocity, the rubrics. They behave like a, and some people, older people, they behave like a child. So there are the rubrics like precocity and the name. Age reflects the relationship of mental aspect as well as the physical state of the life. Now, what is the sex? There are only three sexes: male, female, and bisex. Now, noting down that it may not require questions. You don't have to ask, are you male or female, because you can see it, look at it. But important aspect is that whether that male is looking like a male or it is looking like a female, or female is looking like a female or female is looking like a male. This is important because here we have this is you see the picture. This is a male. This person is male, but he is looking like a woman. And this is why he is looking like a female. And this person is also behaving like a female. So this is a feminine character. This is a feminine character. Then masculine character in the female are there. You can see some people who have some girls who look like a man. See the changes in the type of the faces. and this masculine character. You have beautiful rubrics in the your repertory, and you can get a better understanding about all these medicines. These are the portrait building. Then birthplace, from where he has born. Birthplace has a very beautiful reflection on your on the part of the life where you have born and where you have been after being captivated from the uterine life or after getting released from the uterine life after the birthplace, and you get accustomed to the place where you are born, and with this you grow into your life, and that are your familiar place. But there are the birthplace and then the changes of place. So indwelling parts are there, and different type of the birth. Some people are born in the hospital. They are either normal delivery or cesarean delivery or breech presentations. So they have the impact on the patient's life. Some are born at home only under the care of the grandparents. Some are born at the home by home visiting nurses. So it is the chances on any other during the working condition of the born. Have you heard the child being born in the train toilet? Have you heard the child being born in the air flight? And in your epics, there are the birth of the Sita, the goddess Sita. She was born in a field where while the Radha Janak was plowing the field, and Lord Krishna was born in the chain. So, what the life, what the change that you can observe. This is very important. The birthplace has got great importance in your life. Now, address. Usually there are two address, present address and native address, but you may find frequent change in the address of the patient. Now, if the patient is present address and the local address, present address and native address is the same, he is not a individual, he is not a, he is a very, uh, he may not be the changing, may not be liking the change in the places. They changing from one place to the other. Why he is changing from one place to the another? Because he is in the transferable job. It is his compulsion or by his choice. All these questions are very much relevant in the patient's life. Now, addresses. Address is the native address. It provides the originality of the state. One should try to correlate with the nature of the surrounding. Present address, it should be looked to effect of the change of place in relation to native place. Both mental and physical aspects need to be verified, and then frequent change in address, whether it is wandering nature of patients or no satisfaction with one place or requirement of job as in the business and traveling agents or the medical representative like that. So these are the things, and this gives you the nature. It has got the indication. Don't fix up your mind by simply but you have to inquire, make an inquiry, because it will clarify your fixation of the mind. Then complete address. What is the meaning of the complete address? The residential address, office, profession address, telephone contacts, mobile contacts, nowadays email contacts. Some people don't have the email contacts, fax numbers, some may not have some may not have the web address. So these are the essential aspects. You must take note of this, because this is required for your professional ethics also. It is required for finding out the nature of the patients also. It is helpful in every way. Now comes the religion. Religion plays a great role in the life of the patient. It contributes the type of the personality development. Cultural differences can be noticed in each patient coming from different cultural and society. Thus, while judging the value of the symptoms, this aspect needs consideration. One may need One may get nature of the religion by knowing the name, such as a religion have less definitive type of the sun. Nowadays, some people have started changing their name. If the Christian is having the Hindu name, Muslim having the Christian name, now these type of the things you are getting now, but they gives you the type of the person. So you have to ask about the religion, the caste, it has got the great impact on your life. Some people are very much attached to the ritual or perform worship as a regular routine with great care. Some people simple have faith in their religion but no much attached to the ritual. Religious mania people have mind constantly taking and talking about the God and the religion. And then religious fanatism can compel some people to do some activity for the sake of the religion. Yet there are people who do not believe in the God and have no religious faith. Indifferences to the religious matter. Criticism of other religion in spite of belonging to the particular religion, one may be indifferent to his own religion. All these are the rubrics in your economy. Want of religious faith, too much occupied with the religious faith, and then the religious fanatism, all these are the rubrics, and they are going to give you a big understanding about the patient's life. Now, economical status. This is a very crucial part because your economic is decided by your personality is decided by the economical status, as it impacts on the living standard and conditions. A person belonging to very low income status will have the natural tendency to take care of the money matters, and it may be way of life to remain anxious about earning, and such rubrics average should not be thought. If a man coming from the poor family and he every penny counts for him, and he's saving, when he has spent, he spend it very carefully, then he is not a average person, he is not a greedy person, because he has to manage everything within that. And if a patient from a rich family and hardly to take care of the medicines, and sorry, uh, hardly to take care. Ah, patient coming from the rich family will hardly care for the money. Rubric extravagance may not be a thought. That's the opposite of the low income group and high income group. The high income group, they spend money lavishly, and economical status can be evaluated from various aspects related to the patient's life. Then questions for the economical aspects. Whether he is dependent on some one parent or guardian or other, if like a student he is dependent, where he is dependent on the guardian or the parent. How he has been brought up in the hostel, at the home, or with care, what type of the care. His own earning from his business, job, or other sources. Inquire about how much he is satisfied about his earning, what he plans to earn more or manage his life and the family, what he plans to earn more or manage his life and the family. These are the important questions that needs to be asked so that you can get the economical, because economical status is the building factors for the personality. Then social status is also very important. Social status is very important because human beings are concerned with his position in the society, and which is the ego part of the person. He may have great craving to be with the people, and he may also require time for himself. This balance is greatly affected by his social position. A leader, a follower, a worker, thinker, service provider, or a creator. Many, many more desires are the various nature of liking among can be found among each individual, which is deciding the personality. During the case taking, trying to establish a social status simply by only observing or by knowing the job occupation. So it is not the job of it. If a leader is seated before him, how much socially worker he is, whether he is a selfish man, whether he is a very generous man, whether he has a sympathetic nature, this can be looked for when you know the social status. Then inquiring about the social status, what is the nature of his work? how he engaged himself with the activities of the day, how much he is satisfied with his brain situations of the working, and what are the choice of work he want to do. Suppose a man is working in a secretariat, is a clerical job. Whole day he has to sit on the table and he do the writing works. But this may not be his choice. It is by compulsion he is doing for the earning purpose he is doing. He may have the liking for the music. He may have the liking for reading. He may have the liking for something which are hidden or suppressed at some corner of their mind. Then martial status, the relationship, the family relationship, and the life. That is important. Living in relation is one of the most important aspects of the human life. This living has been looked seriously and become customary of an individual. This has generated several impacts on human life and different categories of people were developed. Now we have so many type of the people who are living in the society. So uh, let us see this type of the people. Getting into the child, adolescence age, adult not married, disappointed with the marriage, for pre-marital relationship, married, divorce with the reason. Widow, widower, at what age, remarriage, change in marriage, living in relationship, they are living together but not married, scared of the marriage, obsessed with the idea of the marriage. Everything are important. If the persons don't want to marry, why he don't want to marry? Because he may be fearful about his physical structure, physical ability. He may be scared about, fearful about the managing the partner's responsibility. So many questions are there, and that gives you the different meaning for each of them. Then choice, how he is married, by choice or by his love marriage is their own settled. Arranged by the family members, arranged by the social status or childhood marriage. All these are very common in your society. Then your food habit is very important. Survival of life is directly related to the type of food one is taking. Food habits are affected by the various factors. So the food habits, uh, your educations, your economical status, social status, family background, values, health, technology, religion, food availability, and ethnicity. So all these aspects makes your food habit. What type of the food you are eating? You are eating rice or you are eating chapati or you eating bread. Something it is dependent on all these factors. Education, you know that this food is good or not. You are able to afford them, buy them or not. Your social positions also, you eat something differently in the restaurant, and then your family background is also important. So everything are important, and that makes you the understanding. And when you ask the question about the desire for the food and aversions and aggregations, these things has to be considered to get into the right approach. So now another factor is the food consumption behavior. You are thinking about the physical, chemical, nutrient properties of the food, environment, person-related factor. There are biological, psychological, personality, marketing, economic, social factors. So these are the how much I earning, and sometimes I have to eat more. I want something, but I cannot buy that. So these are the aspects where you are getting the suppression of your desire, or you are getting the consumption or not. Then his place, food habit is also dependent on his place of dwelling, from where he belongs to, his religion, his social status, his nature of job, his mental state, his physical makeup. There are distinct bent of mind at the type of the food preference, which may be included in the daily routine. Absence of these items will create some uneasiness in him. This may be regarded as habituated. Then food items. What? How many types of the food habits we have? We have the staple food. Staple food means constituting the main course of food like rice, chapati, etc. It is the routine item. Beside the main course accompanying to satisfy the taste bud like vegetable chutney, like that, and then pickles, and then desserts, sweets, health conscious food. There are some people who are very much conscious about their food, so their liking are for the salads, fruits, or the sprouts like that. Antioxidant foods are the item. So you can divide and on the this. Suppose patient says staple food, and he is belonging to a particular region where rice is grown well and it is fun. So it is not the symptoms; it is just the way of the life. Chapati, like similarly. Then what type of the vegetable he is like eating, what type of the salt taste he is getting, what type of the sweets he is getting. This is all these factors are important for your taste. Then where he consume, how he uh, eat, the eating habit. So distinct liking are there, distinct dislike are there. Food aggravates and allergic, and food emulates and agitation. So food are consumed. The food, we have the food desire, aversion, and then aggravations and emulations, and these area we have to look into. Now, patients coming for treatment have varied nature of activity. Awareness about them helps a lot to the individualizing them. So job and occupation. So the patients are coming from the different natures, and their awareness will help you in it. The purpose of case taking in homeopathy is only to make a totality, to individualize totality, not to generalize, but to individualize a case, and this is the purpose for the. And in this aspect, this is the introductions part. This much is going to give you. I say that when you have make a good introduction, half of the case taking is complete. Half of the case taking is complete, and rest will require not so much, will not require so much questioning, but when you have like that. So introductions is very crucial for you. Introductions has to be taken done very carefully. So you have to know about the occupations, what is his profession for a person who is adult or grown up, what is the nature of his profession, service, delivery, business, physical activity, how much he is involved in his profession. He can know by asking the questions on one devoted time, the routine and frequency of attending his job. What is the importance of his occupation, seriousness about his profession, taking occupations casually and taking occupation seriously. Then how he is behaving, laziness during the work, nothing at work, indifferences about his occupation, feeling about his occupations better or worse, laziness in performance, how active he is in occupation, desperate of getting job, frequently changing with the job, strange relationship at the workplace. These are very important area that gives you the status of the mind. There is a good rubrics in your repertory, and that will lead towards the individualization. So occupations and job are related to the activity as well as likes and dislikes of the person. Employment, working in an office, factory, shop, or with individuals, career, it courses through the life, profession, a vocation found upon a specialized training, job, a regular activity performed for payment, vocation, an occupation to which a person is especially drawn, management occupied, occupations, business and finance, operations, occupations, computer and mathematical occupations. Next is architect engineering occupations, life, physical and social science occupations, professional gambling occupations, community and social service occupations, legal occupations. occupations. Then education, training and library, art, design, entertainment, sports and media occupations, healthcare practitioners and technical occupations, healthcare support occupations, protective service occupations, food preparations and service delivery occupations, building and ground cleaning and maintenance occupations, personal care and service occupations, sales and related occupations. Then office and administrative support occupations, family, farming, fishing and forestry, construction and extraction occupations, installation, maintenance and repair occupations, productions, occupations, transportation and material movement occupations, military specific occupations. So, introductions paves the path for onward history. Now, once you have established a good introductions, wrapped with the patient, you get a new path. You can enter into the patient's life very easily. And detailed introductions have meaningful understanding to indications of symptoms leading to the rubric selections. So, that this with the thoughts and understanding, I have completed my uh, presentations on the matter of introductions during the case taking, which is very much essential for your case take, for your practice of medicines, practice of homeopathy, especially when you are dealing with the chronic cases. Now, with this, I close this session and thank you all for having a very uh, patience listening to me. And you can find me at my web email ID risdth at the rate of gmail.com, or you may have WhatsApp on me on 943102062. So with this, I close this session this evening. So thank you. I see that too many people have joined this session. I am happy. We are our group are increasing more and more, and I hope you will keep learning. And in the next session, I will go into the taking the present complaints. After the introductions, you have to take the present complaints, and this will help you understand, have a more meaning for that. So I thank you all for having a good listening. If you have any questions, you can keep me. Uh, you can contact me on my email ID that I have given you, or you can uh, even make a telephone call to me. So thank you, and thank you very much for listening. This session is closed now. We'll meet again on Thursday.